So I'm going to show you a loading technique to the front part of the thigh. That's roughly about where the hip bends to right about where the knee bends. So you can use a ball, which I wouldn't suggest if you're first starting off. You can also use a foam roller, or you can use something equivalent. I'm going to demonstrate using a foam roller. Two different positions you can try this in. You can try this against the wall, or you can try it lying face down on the floor. I'm going to demonstrate lying face down on the floor. So I'm going to take the roller, I'm going to place it on the floor. Now if the foam roller is long enough, you can place both your thighs on top of it. I'm actually just going to place one thigh on top so you can see it. So I'm going to go down, I'm going to start right where my hips are. So now I have different points of contact. I have my opposite knee on the floor and my foot on the floor. I have my forearms on the floor. So 3 points of contact, and then the fourth one is actually the one that's rolling. So I'm actually starting at my hip, and then I'm slowly going to crawl this direction so the roller goes down towards my knee until I feel an area of sensitivity. Once I do, I'm going to hold that position right there. And then there's two different methods I can use. The first one is called the seek and destroy. So I sought an area, now we're going to quote unquote destroy it by just adding some additional pressure or load or weight onto that structure until it kind of melts or it kind of decreases in sensitivity. Once that happens, then I can progress to the next tissue. So I'm going to go down towards my knee until I find another sensitive area. Boom, right there. I'm going to show you the second method. That's called the pin and stretch. So I'm going to pin that structure down, and I'm just going to stretch out the tissue. So I can bend my knee until I feel an increased sensation into that target tissue that I'm working on, slowly backing off and doing that exact same thing. Number two variation is I can hold that knee bent and swivel in and out. So now my foot is going out away from my opposite leg, and then I'm moving it towards my opposite leg. And then the other variation is I can keep my leg there and then just kind of sit up a little bit taller. So rounding my back a little bit more backwards, and then coming out of it and then straightening out. Kind of like I'm going into this position and then going down. Sometimes that might cause some back discomfort. If it does, don't use that option. I can also use my ankle as motion too, so I can point my ankle up towards the ceiling. I can move it around in circles, trying to see if that increases the load or sensitivity in that target tissue.